Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Ziprasidone. Its brand name is Zeldox. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Ziprasidone is an antipsychotic agent whose effects are thought to be from its antagonism on dopamine D2 receptors as well as serotonin 5-HT2 receptors. It also has high antagonistic binding affinity for alpha-1 adrenergic receptors and some other types of dopamine and serotonin receptors. Lastly, it has moderate affinity for histamine H1 receptors. Now, in terms of indications for use, Ziprasidone is indicated to be used as monotherapy in the treatment of manic or mixed episodes seen in bipolar 1. And in the same situation, it's also indicated to be used as an adjunct therapy alongside with lithium or valproate. And lastly, it's indicated to be used in the treatment of schizophrenia. Now, before somebody was to use Ziprasidone or Zeldox, there are some contraindications they must clear, as well as some precautions and warnings they should be made aware of. It's contraindicated to be used with Class 1A and Class 3 antiarrhythmic agents. It would also be contraindicated in patients who are using medications that are known to cause QT prolongation. Patients with uncompensated heart failure would not be able to use Ziprasidone. Patients in the acute recovery phase following a myocardial infarction, or in other words, patients who have recently had a heart attack, would not be able to use Ziprasidone. And finally, it would be contraindicated in patients who have a history of QT prolongation. Now, in terms of precautions, Ziprasidone is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. We want to avoid using this medication in the elderly population because it will put them at an increased risk of experiencing a cerebrovascular accident, and their mortality would increase as well. We would also be concerned in patients who have a history of falls, as this medication may put them at an increased risk of experiencing falls, therefore fractures. Patients may experience orthostatic hypotension with the use of Ziprasidone. Patients with pre-existing cardiovascular disease would be at more of a risk of experiencing this. A potentially fatal drug reaction with eosinophilia and systemic symptoms, also known as DRESS, has been reported with the use of this medication. Severe cutaneous reactions have also been reported with this medication. An example of this would be Stevens-Johnson syndrome. A dose-related rash or urticaria has also been reported. The medication should be stopped if we cannot find an alternative cause of the rash. Hyperglycemia has been reported. Some cases have been extreme and have been associated with ketoacidosis. Some patients experience metabolic changes such as weight gain or dyslipidemia. Should be used cautiously in situations that contribute to an elevation in body temperature. Examples of this would be strenuous exercise, dehydration, or exposure to heat. Patients should be made aware that fatal agranulocytosis has been reported. Life-threatening neuroleptic malignant syndrome has been reported. The medication should be stopped at first sign of this. Some patients have experienced potentially irreversible tardive dyskinesias. There's a chance that suicide risk may increase with the use of this medication. Patients at a high risk of suicidal behavior should be more closely monitored. And lastly, in terms of precautions, it should be made aware that priapism has occurred, and in some extreme cases, surgical intervention was required. And once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Ziprasidone, they can expect to receive their dose in capsule form. When this medication is being used as monotherapy in bipolar disorder, we would start off with an initial dose of 40 milligrams given twice daily. It would be important to tell the patient that they must take the medication with a meal. On day 2, we would give 60 or 80 milligrams twice daily, again with food. And then the patient and physician would work together to find the right dose that works for them. The usual maintenance dose would be either 40 or 80 milligrams taken twice daily. The main things to consider here would be that the patient is getting the control of their symptoms they need and they can tolerate the medication. When it's given as an adjunct therapy, the dosing would be the same, 40 to 80 milligrams taken twice daily with lithium or valproate. In schizophrenia, we would start off with 20 milligrams taken twice daily, and then we would increase the dose no more than every 2 days until we reach a dose of about 80 milligrams twice daily. During maintenance therapy, the goal would be to use the lowest possible dose, and because there's not much evidence to support the use of doses greater than 20 milligrams twice daily in schizophrenia, some patients will just use 20 milligrams twice daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Ziprasidone, so I'll go over some of those here now. Rash can happen up to 5% of the time. and about 10% of patients may notice weight gain. Constipation, diarrhea, nausea, and vomiting all come in at a rate between 5 and 10%. Akathisias can happen between 8 and 10% of the time, and 5% of patients may notice anxiety. Dizziness may happen between 8 and 16% of the time. 14% of patients may experience somnolence, and 10% may experience a tremor. Abnormal vision can happen between 3 and 6% of the time, and 8% may experience a respiratory tract infection. Now, some more rare but serious side effects would be tardive dyskinesias, neuroleptic malignant syndrome, priapism, dysphagia, disorders of the skin, or QT prolongation. That's all we're going to talk about today with Ziprasidone or Zeldox. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.